now online, but we're just about 2 minutes early. So we can use that opportunity to look at Facebook, tag people onto the program and encourage people to actually share the program. We will be starting 6 o'clock on the dot. So we're just like 1.5 minutes earlier. Let me see if I can actually that goes into, yes. If you're joining us, you're welcome. We're just waiting for another minute for us to start the program. So today we're talking again about COVID-19, but I will be telling us more about the reason why we have to do this. We want to know more about the things and, exploring the gains from COVID-19. So let's do a watch party. Get people more onto the program to join us, and then we tag more people. If you are joining us, please just share the program. Just share and share and share for other people, for others to actually benefit from it. Okay. Right. So it is 6 o'clock. Thank you so much, viewers. You're welcome to another episode of Clinical Health, the program where we enlighten the public about topical topics in health. Today, I have again with me Professor Osagbemi. We want to talk around. We're going to carry on our discussion from the last episode on COVID-19. You're welcome, sir.
Thank you very much. And good afternoon, good evening, as usual, to everybody that's listening to us from all over the globe.
Topics in health. Today, I have again with me, Professor. All right. Okay, so can you hear me, sir?
I can hear you clearly.
Brilliant. So we want to, can you introduce yourself again so that for viewers who were not with us the other time, they understand? Yeah.
Okay. Once again, my name is Osagbemi. I'm a consultant public health physician and a professor of public health. I'm based in Ilorin, Nigeria. I work with the teaching hospital here in Ilorin and the University of Ilorin. I have special interest in disasters and public health emergencies, including epidemics, one of which is COVID-19. So I've had quite a range of experience in that, in the epidemic management for some 2-3 decades thereabout. In the present dispensation, as I said before, I'm the apex of the epidemic response in my teaching hospital. I'm also a member of the technical committee for COVID-19 and other epidemics in Kwara State, Nigeria. Thank you.
Thank you so much. So, last week we were talking about COVID-19. We started by talking generally around the virus itself, how it spread, starting from somewhere in Wuhan and has spread to cover the whole of the globe. We have talked about quite a lot of interesting topics on how it spread. We talked about the community spread that seems to be a major issue at the moment, and we're about touching on how this community propagation has led into various other things. And suddenly after the program, there's been a lot of question around, what are the gains, what are the things that we also lose. We've lost during this period. So on that basis, we've invited you back to come and help us throw more light into this and then see how we can enlighten the public on those important questions. So how do we take it? Looking at COVID-19, what have been the gains, obviously, since the start of all this? Or how do you want us to approach it?
Okay, let us have in the background that we actually had some painful experiences with the virus in Africa, particularly in Nigeria. Though we pointed out earlier on that the infection rate and probably the death rate is lower in our own environment, but that does not mean that people are not dying, people are falling ill. So we will not take that for granted. Therefore, as at now in Nigeria, we have about 26,500 cases, about 600 deaths. This may look small, but if you look at the percentage to a family, if one person dies for a probably preventable cause, then that's a lot of loss. That's also a rider to the fact that some people died and are still dying. So these are painful experiences. We've seen this paralysis of our health system. In the last 3 months, for instance, only COVID-19 has occupied the health system. Other health conditions are still there and they are still killing people. So if you are saying 600 people have died, it's small. How many people have died from other diseases? So it has added to our burden of problem. Look at our economy. It paralyzed everything. People could not move out, interstate travel logged, and so on and so forth. Then the economy also paralyzed, and then social activities went down. So these are some of the things. But so to say, it has not been all that too bad in terms of the gains. We cannot say we have gained from people dying or falling ill, but from the experience and the lessons we have learned, being able to build our capacity to some extent, meaning that we're building some little critical mass of experienced and trained personnel in terms of how to manage epidemics. We also have some level of preparedness. Most importantly here today, I think our focus is how do we move, assuming we're able to conquer COVID-19. What do we do? What do we do in such that should any other epidemic occur, do we have to start all over again? So that's the major focus of today's discussion, meaning that from time immemorial, you can see in the holy books, epidemics have continued to occur, and they will continue to occur. Sometime last year, in the 182nd inaugural lecture of the university, it was pointed out, University of Ilorin, it's on the website, that disaster and epidemics continue to occur. So, and we have had many, that from HIV, AIDS, bird flu, Ebola virus, and others will still come. So, and most of the time, it has always caught us unaware. So the important focus today is that future epidemics do not meet us at ground zero. Thank you.
Yeah, thank you so much for that. So now we talk about the future. Now, from what we're doing, because when we look at what's going on now, in the healthcare sector, I thought when we went into this COVID issue, I was looking at I saw an opportunity, a very big opportunity for us to revamp our system, a huge opportunity to move things forward from where we were, especially from the primary care point of view, to to a level that's people will really benefit. But what I see, it sort of puzzles me, and I mentioned it the other day. I mean, during the last interview, that there are a lot of concern in the public. People are saying, "Oh, it looks like things might not be in the direction that we're thinking." Looking at the future, are we going to improve our healthcare system? Will things still remain the same way it was before COVID? What are your views about this, sir?
Yes, things will certainly not remain the same way. We are probably worse off now, but if we reposition ourselves well, then we can pick up and leverage on the lessons we have learned in the present circumstance. Let's say the idea that, okay, people could not get treatment, even for basic things during the lockdown. And before then, people at least could go to the hospital, get their communicable, non-communicable management and all that. We dropped down because we focused on COVID. So the re-energizing, we should leverage on that to go on and strengthen our primary healthcare system in such a way that at least the basic things, mind you, all along, it's not as if as a country, we don't have the capacity to move on. It's just that, just like in any sector of the system, we have not failed to translate our resources to our benefit. Take, for instance, we have doctors, they may not be enough, nurses, others, health personnel. We have funds, so to say. We have policies in place to address health system. We have documents in terms of health policies. We have health facilities. We have money probably to buy medicine. All these structures have been there, but we fail to tap on them. Why? Simply because of our psyche, I'm sorry to say, our patriotism and national commitment. I'm not trying to say we don't have sense of value, we do. But I think we are trying to place them wrongly. Why? Why can't we translate all these to benefit basic things? Some people don't want to get basic things. Some people amass the wealth, keep it for children unborn and all that. Before, there was discipline. We fought a war, even a war against indiscipline. And we were picking up. Why can't we go back to such a system? It's time for us to rethink, because the COVID outbreak, though it's a health condition, has taught us a pan-systemic effect to look at ourselves as a nation.
Well, seriously, how do we really? I mean, what's your advice? Yeah, what we're touching on is the policy making. Of course, we all have our own hands that we need to put in there and get it dirty and move things. But everything hinges on majorly on the policy maker. How do we actually move, tangibly from where we are to a situation where we'll say, yes, we're moving forward? I'll be honest, I've not seen us moving. There are gains, but when we look at the healthcare system as it stands, I've not seen Nigeria really moving forward during this period. Yes, there are a few things here and there we can talk about, but when I look at Ghana as an example, I was listening to Ghana president addressing the leaders in Africa. Was it yesterday or day before yesterday? And I for some reason, I feel proud of him, to be honest. And then the way, when we want to move forward, we need to really be doing things tangibly and being quite keen to actually move things forward. I've not seen that in Nigeria. What can we do physically and tangibly to move this country forward from the healthcare system angle?
Well, your question is pregnant with answers, so to say. Maybe I will not have most of them, but the most important thing, as I said earlier on, for us to learn our lesson and pick up from there. And later on, I mentioned that if we fail to pick up, then we are doing ourselves a disservice. Let's look at the specific steps that are practicable. For the first time, I've seen tangible contribution from private public sector into our funding, particularly for epidemic in COVID. We saw banking sector, they formed something called Coalition Against COVID, they donated money and all that. This is one step. Instead of waiting for probably international donors, we were able to get some things from within the country. We can leverage on that. Also, the structures we have on ground in terms of facilities, they are there. We can develop them. I remember you mentioned on the political will. You're talking about president somewhere and all that. Yes, we need it, but we also need the followership. Let them follow and do not frustrate whatever effort is being put in place. Now, but the moment, again, we fail to address the issue of corruption and all that, and which is on this discussion, we may not move forward. But even within our health sector, what can we, including me, those of us in the health sector, do with the little that we have? If we can strengthen our primary healthcare system, even if it's only that, then that will give room for us to look onward and forward to developing our other health systems better. The system has been as bad as you have said it. In fact, one of my friends and colleagues put it that this is a heavy population, sick population with a sick health system, which is true. And then it's not as if we don't have ideas on how to solve them. If you read his lecture, the references are there on our website at the university. Solutions are there, we know them. To translate the link between the governance, the followership, and the manipulation of the system is what we are still trying to do. But let us try and strengthen the basic thing and follow the laid down policies, guidelines that we already have. Somebody mentioned about health tourism. That, okay, let us stop people from traveling abroad to go and take health services or receive health services. Well, that may not be the solution. Because no matter what we say or do, majority of our problems are still basic and primary healthcare. We have not even strengthened that. And if we strengthen that, there will still be a certain percentage of our people that will require services that probably we are not able to provide effectively in this country. I'm not saying we should not develop to that level. We can, but let us even start from the basic. Come to our general hospital or teaching hospitals. You see people coming with things that we can take care of at the primary level. Why can't we strengthen them? Why can't we have the structure? We've tried them before. They have worked. Before, we had directory for food and rural infrastructure. They performed. We saw evidence. We had PTF, not the Presidential Task Force this time, but Petroleum Trust Fund. We put some of the drug there into primary healthcare. The places opened up. People were going and attending and made success. We had the Education Trust Fund. In tertiary institutions today, one of the major palpable things you can feel are the influence of Education Trust Fund. Are we going to go to Health Trust Fund? Why can't we? We've had the National Health Insurance Scheme. How does it address primary health care? So it's not as if we lack policy and direction and personnel. It's just the link. And I think the major solution, one of the major solution and linkage to make that work is the national commitment, patriotism, and sense of value. Take somebody's head, for instance, important. Sometimes you say, how did we get wrong? Or how did we go this wrong? Look at I think we were trying to say, okay, earlier we were trying to mention governance, policymakers. I said it involves all. Look at the elites. Part of leaving us wrong happened when, if you look at the time the public health and public education sector was collapsing, people started, okay, the time we had federal government colleges, unity schools, we were doing very well. These schools became bad. Instead of the elites sitting on the policymaker or the government to correct it, they went to start private health sectors, secondary schools, up to university level, expecting children to go to private. Look at water supply. The water supply is failing in the metropolis or in the town. Instead of elites and the so-called technocrats to address the situation, they will go and sink their borehole and wells. When electricity is failing, what do? We go and buy generators, inverter, and so on, instead of revamping the system. They now take it down to the health sector. When public health sector fail, instead of now, I won't say agitation, but working to make sure that the system works, we go to the private sector. So one of the things is to make sure that the public system work. And unless we do that, then we continue to degenerate and fail. Thank you.
Thank you so much, sir. I mean, this is an area that I feel very passionate about because I haven't done a few things abroad. When I see the way things work in England, for instance, and then you come home, and I could see that it looks like we have the ingredients. Everything is there, but for us to pull this ingredient together and to get the spark to just light it up, we can't just get ourselves to do it. It has one way or the other. Is something somewhere sabotaging the whole thing. You see, when this whole thing, the COVID-19, when it all started, I looked at the opportunity, especially when the private sector started donating. They started putting money down. And I thought, wow, this is big. An individual organization donating 1 billion naira, or and we had quite a number of them like that, dropping this money. And I thought, if we can use this money to actually, those are ingredients. We have the doctors. We said, I mean, in terms of the human resources, we have those resources. They may not be enough, but we have it. If we are smart the way we pull them together and use them, then we'll get something. And we can only move forward when we do something. We won't move forward until we do something. I don't know why and how. You talked about that money, the private sector money that was put down. And I think I asked this question the other day as well. Where is the money? There are a lot of agitation that the money, some of this money has disappeared, and the way we even manage the money itself, I don't know. Maybe it's outside the discussion that we're having today. But sorry,
it's not really out of the discussion per se. You see, the issue you are trying to raise is that of accountability, responsibility to people. It still goes down to the issue of patriotism and commitment to nationhood. You see, until many things revolve around poverty too. Even the so-called well-to-do, they still want to consume more or package more for the generation yet unborn for them. If the system works,
that's why. Sorry, sir. That's why we actually. That is what is causing the poverty. The fact that people are. I said that's what actually causing the poverty that we're dealing with. An individual carrying the money that everybody in the whole neighborhood is supposed to use.
And let there be sanction. I'm sorry to interrupt you there. Let people pay correctly for what they have done wrongly. If they have robbed the masses, let them be penalized appreciably. We should stop paying lip service to our deterrents. If somebody was found to have embezzled 50 million naira, and he comes out and says, okay, we came out to load our like plea bargaining. Okay, I'm sorry I did that. I want to return 5 million. And then, okay, go. So until laws are made and implemented, laws are there, but we have to face it squarely. If we don't do that, people will not learn. I told you we fought a war before. They call it war against indiscipline. If you fail to queue in a place, you have penalty. If you drop a piece of your bottle water empty on the street, you are penalized. If you stole government money, you face it. I'm not talking about draconian and being rigid on people, but when people know and truly implemented that, okay, if you're a health worker and you mismanage drugs, you manage resources, you divert patients from public to private, you lose your job. Then people are more likely to sit up.
Right. Thank you so much. Right. So now, if we look at the lockdown now in the past 1 week now, since we had the last chit chat, I realized that there have been a lot of things that happened. The lockdown has been border. For instance, interstate lockdown is being eased. People can move now, and airlines have been opened, to do their businesses. Now, a way, that looks a bit worrying to me when I look at the statistics. When we look at the statistics, the number seems to be going up. And I feel that's actually a kind of a reverse
priority.
Yeah, what possibly we should be doing. But obviously, it'd be nice for you to help us throw more light at this. If there's something I'm missing here.
Okay, it's not that we are misplacing our priority by opening up. We looked earlier on at the benefits of lockdown, and we found out that based on our socio-economic and socio-cultural setting, we could not sustain lockdown. Even epidemiologically speaking, if you do partial lockdown and tell people to go out for 2 days in a week, then they are infected in those days. So many things, people could not go to their work, basic economy could not be maintained. So we felt there's no point. And then the so-called interstate travel, people were beating it. So we didn't really lock down. So the fact that we are seeing more cases is also a reflection that we're doing more tests. So the more tests, the more we see. So that gives us the impression that we are not really missing our focus. Then for how long do you really want to do a lockdown? If you release the lockdown, I mean, if you start a lockdown again, and probably cases go down, because the cases are already in the community, by the time you open up again, to peak. So for how long are we going to be doing this and that, considering the cost at the expense of even other health services? So to me, it is not really that we are missing our priority, just that whatever worked elsewhere in terms of lockdown is not likely to work, and we have seen that it's not working in our own environment. In places, so in most of European countries, for instance, people don't even know their neighbors. But here, you tell somebody to lock down or quarantine things at home, you should not go out, it's not going to work. And we have seen that. So it's not as if we are missing the point. The herd immunity, so many other things that we need to develop has to grow. Because whether we like it or not, the virus is already in the community. And there's one important reason why it is like that, and it will be like that. You see, the virus has what we call extrahuman reservoir, meaning that there are other animals that can pick it. So even if you take care of human beings, you observe, wash hand, and other, assuming it's already in other animals, then even if you reduce the lockdown, the disease will still spring up again. Look at polio. Poliomyelitis, one of the major advantage we had was because it didn't have any extra human reservoir. We didn't have it in animals. So we could focus on human beings, and then we could contain and probably eradicating it finally globally. So the same thing, if a disease is present in the soil, in the air, in animals, if you are focusing only on human beings, you may achieve some level of success, but the moment you release or you relax some efforts on human beings, then the disease will spring up again. So the earlier we start doing the other services to reduce, practices to reduce infection, the better. I can leverage on the gains we have mentioned in the past. At least before, people know, now people know that, okay, to combat the virus, you can combat it through controlling yourself. If you don't have to go out, you don't have to go out. You can work from home if you have to. You can wash your hands regularly. You can sanitize. These are basic things you can do to protect yourself. And then we can leverage on that rather than, you can imagine you are fighting a war, you have an enemy, which is in any form, and they are coming to invade you, and then you run and hide at home without fighting. Then they will, of course, eventually overpower you. You can only fight, of course, they say we will fight and run away, that's another day. But in this sense, if you keep staying at home, the virus will eventually even come to the home and then becomes a problem. So you can only fight it by going out and explore the ways to prevent yourself. And then we begin to now talk of how do we now combat the virus specifically. That comes the issue of vaccine. Yes. Because people have been asking, why can't we have vaccine? Why do we develop vaccine? Why these we have scientists and all that? If you know, and let people know that the process of vaccine development and use is not something that happened, not even in 1 year. Remember, the way our vaccines are developed can start from one. You can take the blood of an infected person or animal and purify it and give it to somebody so that the person will develop immunity. That is one way. The other way may be that you even infect an animal and then take part of the blood to treat people and cause artificial infection in that person to develop immunity. Another way would be the modern one, so-called recombinant technology that you use chemicals and other things together to develop vaccine against disease. When you have tried this in the laboratory, then you go ahead and show it to the scientific world. And then the scientific world probably will accept you. Having done that, you now do what we call animal trials, because you don't give an attenuated or weak vaccine to a human being first, because that may cause infection fully. So we have to go to animals, test them with it, with a cord, animal that received, the one that did not receive it, who are the ones infected among them. Then gradually, now have to compare it among humans before globally, before you even to try it in your country. So to say that we wake up tomorrow and say, let us have vaccine may not be realistic. And you will see that the places where they have resources to even do that, assuming they get it even in America, Germany, Europe, and not anywhere in Europe and all that, you think they will bring it to Africa first? It's very unlikely.
What's your take on what's his name now? The billionaire now, Bill Gates.
In terms of what?
There are a lot of controversies going on that Bill Gates has, his own input when it comes to vaccination. People saying that he's doing it as a kind of, yes.
Well, is the controversy about that, I don't think we have any scientific evidence. And the modern brain talk about science. Nobody has really proven anything. If anything, the one we know, he contributed a lot towards the eradication of polio. And polio is globally being eradicated. At least Nigeria was certified. So to me, I will not stand to say, okay, I've done this. Many of the things we get in social media and in so many places, we have to weigh against scientific evidence. So to me, I do not have evidence to say that. The only one I can say, generally, not him in particular, is the fact that, okay, some of the so-called foreign countries where the disease was first, or the syndrome was first diagnosed, are trying to come and test the vaccine or their drugs in Africans. Well, that's an area that you can say, okay, it may be unfair, because we are the last, so to say, to be hit, and then you want to start with us as guinea pig. That area, we need to look at that. But to say particularly that the particular individual had ulterior motive for all that, may be beyond this discussion. And at the same time, we do not have any really documented proof to prove all those allegations.
I agree with you, sir. Now, so we talk about vaccination. I think apart from vaccination, of course, with a lot of people talk about immune boosters and things like that, and then theories around chloroquine as well, being one of the contributory factors where we're not having, serious impacts of the disease in Africa. Can you throw more light at that, on that, sir?
Okay. Remember at the onset of the syndrome or the disease, COVID itself, within 2 to 3 weeks, we began to hear of the use of chloroquine in its treatment. And up till now, no globally accepted replacement has been got or obtained for the chloroquine in terms of part of its treatment. It's not an antiviral agent, just maybe one way or the other. You have to suppress it or treat it. So we now look at it that, okay, in Africa, malaria has been our problem, and we used to use chloroquine a lot. Probably that's what has helped us. But people have asked me, even after the last episode, that, okay, can they start taking chloroquine? And I said no. Chloroquine cannot be taken largely and prescribed for population like that because of what we call false sense of protection. That means somebody who has been taking chloroquine will say, oh, since I've been taking chloroquine, I don't need to wear the face mask. I don't need to do regular hand washing, social distancing, and all the rest. There are selective uses for the chloroquine in this period, but we leave that to our health personnel. Whoever they deem it necessary to recommend it for, they will do that. So whoever is affected or at risk or feel is at risk, please do not go ahead and start consuming chloroquine. It has its own side effects, other issues with it. In fact, one of the reasons why we left it behind before probably was some of the resistant factors. So we do not recommend that everybody should continue to take chloroquine, even if they don't have symptoms to prevent. It is not advisable. We rather say, okay, do your hand washing, do your hand sanitizer, do social distancing, limit your exposure to people, use your face mask, and so on and so forth to protect yourself. Should you now have reason to use chloroquine, the doctors, the health facilities, health practitioner will make a recommendation. The vaccine itself, as I said, we are talking about that. Vaccine is not easy to develop. But what can we do to help ourselves in Africa, particularly in Nigeria? We look at our own remedies. We have the herbs. I'm not saying that concord herb, we have scientists that can research into them. Now we see that to some extent, the alternative or herbal practitioners have begun to refine their products and giving it some value. Can we look at the immune boosters among them? Can we see, because remember, overall, we have not really found any really antiviral drugs. We're only looking at adjuvant or adjutant or things that can help the system to recover. So part of them will be now look at these immune boosters. Can we now make them to standard that we can say, okay, it has followed such procedure, and we have the scientific procedure to do that.
Thank you so much. In fact, a question just came in, which I think you just addressed it. It said we have heard of herbs being used to cure COVID. To cure COVID. What can you say?
Yes, the use of herb to, I won't say cure, but to treat or even manage, let's use that word technically, to support the treatment. For me, I cannot say people should not take herb. And I cannot prescribe here and say people should be taking herb. What I've said is that we can develop our own herbal system and make it to follow our own known scientific method and use it to treat our people. For instance, they say, okay, if you drink lemon juice, lime, and all that, these are things we take normally. They contain a lot of vitamins and all that. Nobody will tell you not to drink lime, but would not say that instead of, you can continue to take all those things. After all, they are nutritional. So we look at it from that angle and see how we can now refine them for specific immune boosting system. So nobody is encouraging the use of herb, but at the same time, let us see how we can refine it. Let me tell you, if you take neem, dogoyaro, for instance, you may have so many chemicals in the juice or the extract from it. Some of them may be injurious to the liver or to the kidney. Some of them may be helpful in boosting immunity. Now, if you are going to consume it and you are just drinking in the aspects that have adverse or undesired effect, you will not know.
Yes.
So, but if we develop it, we can refine and extract the part and remove the part that will make it more scientific, rather than just saying, okay, but I'm not saying people should not take the neem or the dogoyaro, and that's not the issue. The issue I just gave it as an example, that many herbs contain some things that are not, after all, there are some herbs some people take and then they start having diarrhea, having so many things because of the other chemicals that may be in those herbs.
Absolutely. Thank you so much. So, as we're just rounding up now, there are a few things, maybe a couple of things I just want us to this. I mean, for you to help us through more light. how do we reposition or even position NCDC, for instance, say after this COVID, to support other, aspects of disease management? Or is there anything that we can learn from what has happened using, NCDC lately to actually improve our system?
As I said earlier on, there are a lot we can do. And whereas NCDC, I won't say suddenly woke up for reasons beyond this discussion, it's not far from the fact that, okay, they were funded, they were monitored, and so on. They provided us information. We can select our priority diseases and have even daily or weekly information out like that. That is possible. Mind you, as I mentioned earlier on, it's not as if we don't have the structures. We have the Primary Care Development Agency at national level, at state level, even at local government level. We have the NCDC, we have National Emergency Management Agency, the National Research Institute, we have all of them. Why they are not functional is beyond us. But be it as it may, the disease of priority can be, in fact, I remember the first time I came across policy on epidemic management was about 25 years ago. And that's what we are using, and we are just revising it. So we have the structure, we have the document. So it's just to make the system work that we need to work on and move on. So NCDC, well done so far. People say, well, they may be lying, they may be concealing and all that, but that's what we have for now. So let us use that. Let us encourage them, strengthen them, and then whatever lapses they may have in terms of expansion, then we can put effort to look at that in terms of data management and information management, as far as health is concerned.
Thank you so much. Each time when you go on and you come back, it sounds like a lot of the time there's a factor that seems to be a bit constant in the equation of how we're going to move from where we are. And that factor is the human resource, like us, either in the front line or wherever, as health workers, doctors, nurses, pharmacists, everybody. I mean, when I do my teaching, I always talk about there's no how one person can do it. And I feel that's deep, I have that deep feeling about the fact that, as an individual in the sector, we're not really, that sense of ownership of the system and to be able to actually contribute our own effective capability to move the system forward is really, for one reason or the other, is just not there. You talked on something earlier on, like why will somebody in their own right mind, for instance, if it's not poverty, as far as I'm concerned, a doctor, a senior doctor, junior doctor, doesn't matter, divert patients from public sector to private sector, while the public sector that we're supposed to actually front for to improve, we're running it and then improving our own private sector. That psychic doesn't just make sense to me.
Okay.
What is
Let
your price?
Let me come in there. The first issue I mentioned is that of national value, patriotism, commitment, poverty. All these factors, if we don't address them, if I don't see the next person as and be my neighbor's keeper and assist them, then we're not likely to move forward. And the issue of sanction. In public health law, the last resort we have, probably punishment and sanction. But in a system where people have undesired practices, if they know and it's implemented that, okay, if you do this, these are your sanctions, they are likely to abide. So I think the major thing is our sense of patriotism, sense of value to improve, commitment, then appropriate law, and then real true implementation, not plain lip service. So if we face all those ones, they're likely to reach. But there's an important area, the area of technology in terms of our gain. We mentioned earlier on that we could do our meetings, children can do schooling online, These are areas we can leverage on. Look at development. When people are saying, okay, Haba, is it good? Is it that? Can we do it? We can develop. Look at the time the face mask was out of stock and we are buying at exorbitant price. We produce local devices and they are working. Look at the hand washing technology. The set that we are introducing to us, we needed electricity that can be automatic and all that. They have done the one that, you can use your leg to pedal it. These are basic innovations. The face shield, we have improved on it. So we have the capacity in this country and we can tap on our local resources. So let us use that technology and be innovative, do our communication and things we don't need to go out to do. We don't need to do them. Our meetings can be online. Thank you.
Thank you so much, sir. Somebody, well, this more like a comment, I think. So there's one, it says, Prof, what can you say about the health sector almost rolling out the mental health part of the health sector? I believe they are supposed to be working together because a lot of people confused, scared, and blank regarding what's happening. Do you think the health sector are bring all the health sectors along? If yes, how?
Okay, thank you. We know that the health is complete physical, social, mental well-being. So the mental sector, so to say, is part of what, in our team, for instance, we have psychiatrists, we have psychologists, we have counselors, in our own little critical mass in this environment, in my own hospital, for instance, in our team in Kwara. So we are carrying them along. And before we send even people to isolation center, so to say, we send counselors to them. They are briefed. They are told, what are you going to experience there? What's the place going to be like? Some people even react and feel very bad. We try to, find a leeway. So we are looking at the palliative in terms of mental rehabilitation and so on. So it's an area, it's good that has been mentioned. If any part of the country, any state, they are missing it out, they should also incorporate it. And that will also help to have more completeness in the delivery of the services, particularly to COVID and other health services.
Thank you so much. I think on that note, we'll be rounding up the program today. I hope our viewers have found this quite enlightening and useful. Prof, we really appreciate your time.
Thank you very much.
For your fatherly support all the time. It's really commendable. Thank you so much, sir, for the time.
Thank you.
See you on Saturday when we talk about breast cancer. Thank you so much. Bye-bye.